And yeah, I'm a GP trainee, and I've just come back to training about 2 months ago after doing the Sustainability Fellowship at NHS England, which I would thoroughly recommend when you guys qualify, looking into that. So I'm just going to talk a bit about climate change and what we can do. So I'm just going to talk a bit about climate science, but not too much, how climate change impacts on health and how the health service impacts on climate change, a bit about what we're doing to reduce our carbon footprint, and what you can do. So I've been told, I don't normally like to do this, but I've been told that I should always start by talking about my own journey first and how I got into climate stuff. I'm not somebody that's always been environmentally minded or a sort of environmental campaign or anything as a child, or until really a couple of years ago. So about 3 years ago, I was living in New Zealand, and I went on this road trip just after Christmas. That was it, January 2020. And I was in northern New Zealand, and the air was full of smoke, and it was sort of, the sky was opaque in the middle of the day, and you couldn't see the sun, and it was a hot summer's day, and it was all very odd, and you could hardly even really see the sun. And I've circled it there. You can hardly see it because it was smoke from the Australian bushfires, and it really shocked me, actually, because it really brought home to me how bad the climate crisis was. And I think until then I hadn't really sort of seen the effects of it for myself, and it really made me think about how much of a problem it really was. So I then started reading more about climate change, especially at the beginning of COVID, and understanding the links between pandemics and climate change, and how humans interacting with the environment actually leads to health issues and diseases like COVID-19. I'd previously been interested in global health, and done some global health stuff at medical schools, but at the time climate and global health weren't really talked about at that point. That was sort of probably 2013 to 2015 kind of time. And it became apparent to me that what the WHO say, climate change is the biggest health threat facing humanity. And the first thing I did, which was the only thing I really knew at the time, was making personal lifestyle changes. So thinking about like what I ate, what I wore, my consumer behavior. And then I discovered the world of sustainable healthcare, and I started doing some local projects in the hospital I was working at when I came back, started GP training. And then the clinical fellowship came up when I just started GP training. So I applied for that and took a year out, and then I've just come back from it. So what's the situation about climate change? We know it's worrying. 1.1 degrees C is how far we are so far above pre-industrial levels. And climate change is, for the majority, caused by the use of fossil fuels after the Industrial Revolution. And we know that we must limit our temperature rises to 1.5 degree, and that's not a completely sort of set target. It's just that we know that it's possible to reverse it, and if we go much above 1.5, then we can't. But actually, really, every 0.1 degree rise is going to take an increasing toll on lives and health. And we know that even the International Energy Agency, the UN, will say that we've got to get rid of fossil fuels. And so the IPCC, the Intergovernmental Panel on Climate Change, has told us, there was a huge report, 3-part report that came out in the last sort of late 2021 and early 2022. And even the executive summary is 60 pages. So I didn't even read all of it, to be honest, and I wouldn't expect any of you to, because it's a bit unmanageable. So found some summaries, and my summary is this: climate change is already harming people's health and well-being everywhere. We do need to reduce fossil fuels now. And actually, the positives are that climate solutions benefit our health and our economy. So they're win-win-win actions. And actually, the thing that was really optimistic from the IPCC report, which is the bit that's not reported very often, is that climate solutions are possible with the knowledge and technology that we have available now. Oops. So actually, it can be done. It's not impossible. And so what are the health impacts of the climate change? Is it just about polar bears and melting ice caps, which we've been talking about for decades? No, actually, it's about us, it's about humans. So 13 million deaths around the world are due to avoidable environmental causes, which climate change is the most prominent. Burning fossil fuels causes unhealthy air. And actually, even in this country, the UK, about 10% of lung cancers are related to air pollution. And that is likely to be much higher in other countries where there's much more pollution. And actually, air pollution, which is very much linked to climate change, causes increased miscarriages, stillbirths, worsening outcomes of COVID-19, strokes, heart attacks. I could go on. And actually, we're expecting huge displacement of populations around the world, even in this decade and the next decade, due to climate change. And I won't read all of these out, but it just shows that climate change is about much more than just the extreme weather events. So these things do cause injuries, fatalities, heat stroke, but actually there's a lot more to it. There's our water and food supply. There's even in the UK, Lyme disease is going up because we've got more ticks because of climate change. So to bring it home, to make it sort of more relatable, it's important to note the case of Ella Kissy Deborah. And this was a really sad, really tragic case of a little girl who died at the age of 9 from asthma. And she was admitted 27 times in the last 3 years of her life with asthma attacks to hospital. And she lived right by the South Circular Road in Lewisham, which is an extremely high pollution area. And what was really important about her case is that she was the first person to have air pollution listed on as a cause of death on her death certificate. And that was because her mum, Rosamond Kissy Deborah, who you can see at the bottom of the screen, she has been a fierce advocate for this, for recognising the impact of air pollution on Ella's death. And she campaigned for a second inquest into her death. And one of the really important things that Rosamond now says is that they weren't told by clinicians that the air pollution might be having an effect on Ella's lungs, on her asthma. And actually, if it's something they had talked about, there may have been something they could have done to protect Ella from the pollution that she was exposed to. So it's really important as clinicians that we know about this stuff and that we're able to talk to patients about it. And climate change is a health inequalities issue. It affects the most vulnerable people the most. That might be elderly, that might be children. And actually, we know that ethnic minority groups in this country and people who have lower socioeconomic status have higher exposure to air pollution. And actually, one of the other reasons why this is so important is because you can see on this graph that actually the richest 10% of people cause about half of lifestyle related emissions, whereas the poorest 50% of people only lead to about 10% of emissions. So actually there's a huge inequality in who's emitting versus who is actually exposed. And there's also a huge economic cost to the health impact of air pollution as well, which we can't forget. So this leads to climate and environmental justice, which is where we have to not just talk about emissions as a number, but about human rights and social inequality as an issue that is closely linked to climate change. And actually, how are our policies designed to distribute the benefits and burdens and make sure that those who are least responsible are actually able to manage with what's going on when they're not the ones causing it. And it's really important to think about Indigenous people who have a lot of nature-based solutions, about women's rights, as women are disproportionately impacted by climate issues and future generations to come. So why should we be involved in the health service? Why should medical students, doctors, nurses be involved? Because it's such a big health threat and it's therefore a massive health opportunity. Also, the GMC states that we have to be involved. It says, take prompt action if you think patient safety is being compromised, and protect and promote the health of patients and the public. And because climate change is a public health issue, we are obliged to take action. And also we're trusted. You know, we 93% of people in the public trust doctors and nurses. So actually, if we talk about climate change and how we're concerned about it, people are much more likely to listen. So what is the NHS doing about it? So Greener NHS is part of NHS England, which is England's commissioning board. And it's become the first health system in the world to commit to reaching net zero. There's 1.4 million staff in the NHS. And every NHS trust now, and ICS, integrated care system, has been working on a green plan. And we know that it's supported by staff, actually. 90% of staff in the NHS support a greener NHS. And the NHS is 5% of the UK's carbon emissions. That's more than the aviation sector. So we are a really massive emitter. We're the biggest public sector emitter. And our job is to do no harm. So we shouldn't be causing this much emissions, because that is going to be doing harm to all of us. And we've got targets. The NHS has committed to reaching net zero in its direct carbon footprint, so things it directly controls, by 2040. And the carbon footprint plus, which is the things we don't control but we influence, such as patient travel, such as some of the goods that we buy, by 2045. And this graph is worth having a look at the Greener NHS website in more detail, but it shows where our direct and our indirect emissions come from. When people think about where the NHS's emissions come from, we often think about plastic, that we are using too much plastic, we're throwing things away, we're not recycling enough. But actually, waste is like 1 or 2% of our carbon emissions. We've got to think about medicines and chemicals, all the equipment that we use, and our supply chain is massive. And all of these other things, anesthetic gas and metered dose inhalers, are massive hotspots that we can make a big difference. We have suitable alternatives to these. We can think about our patient travel, our staff travel, and our estates, our buildings. So there's a lot of different elements of where emissions in the NHS come from. And Greener NHS is working on all of these different things. And there's different teams within Greener NHS who are working on each of these. So it's a big project that's going on. And yeah, they even unveiled the first net zero ambulance, which is an electric vehicle at COP26 last year. So how do we practice sustainable healthcare? Well, we can work on each of those areas in the pie chart. We can insulate our estates, we can reduce inhalers, but we also need to do all of these things. So preventing disease is going to be the greenest thing when patients don't even need to come to us. So actually tackling disease and tackling inequalities is really important. Empowering patients to manage their own health, that's good for patients as well as a planet. Lean service delivery is a bit jargony, but it basically just means making sure that our care is efficient, making sure that it's streamlined, and then we're not duplicating things or doing things unnecessarily. And lower carbon alternatives, so where possible, for example, lower carbon inhalers or anesthetic gases, or using technology where it helps us. And the inhalers work is one that I'm very passionate about, because we prescribe most inhalers in GP. And actually what we can see at the bottom here is how a metered dose inhaler is the equivalent of 175 miles in a car in terms of its carbon footprint, whereas a dry powder inhaler is only 4 miles in a car equivalent. And actually there are lots of clinical benefits to having dry powder inhalers as well, such as a dose counter so that patients know when they're finished. And actually we know other countries use a lot less metered dose inhalers than us. You can see how many we use, about 70% here. And Sweden uses 10%, and their asthma outcomes are better than ours. So actually we have really poor death rates from asthma, as you can see on the right. So actually the inhalers work as an opportunity for us to reduce the carbon footprint and improve asthma outcomes simultaneously. So sustainable healthcare leads to improvements in health, it leads to environmental impacts, and it also is economically beneficial. So that's what we call the triple bottom line, advantages in these three things. I went on a visit to a GP surgery in Somerset at Frome, and they've got an amazing scheme, which is led by the GP surgery, but is integrated into the council, into social enterprises in the town. And they work on the premise that social isolation is worse for your health than smoking, and there's data to back that up. So they get the community connected to prevent illness. So they have different schemes happening. They've employed social prescribers who work as community health connectors and let loads of people know about all the different things that are happening in the town. And they've decided that sustainability has to be integrated into their core values as an organisation. It can't just be one person doing the green toolkit. It has to be how they decide to buy things, how they decide to manage their estate, how they decide to do medical care, whether they ask about it at interviews, at appraisals. And they said that once it becomes part of your core values, it actually doesn't take more work. It's just a way of doing things, not an extra thing that you have to do on the side. So that was a very inspiring visit there. You can see some pictures of when we went to see them. It's a hot composter they've got in their staff wellbeing garden, an outdoor gym, and that's their staff garden as well. So yeah, a lovely place. And nature brings huge benefits to health as well. So we can actually use nature to improve people's mental and physical health. And there are lots of schemes, even within South London, we found about a dozen schemes which bring people with physical or mental health problems into nature and use it to support their recovery. And that's a picture of one of the schemes down here, which is called A Dose of Nature. So the Centre for Sustainable Healthcare, I'd really recommend this. This is an organisation which runs courses, and there are courses on everything from just general sustainability and healthcare courses to ones on primary care, ones on respiratory, surgery. So they're really excellent. And there's opportunities for students there to do internships, I think electives, as well as going on the courses and things. So would highly recommend looking them up. So what can you do? I like to talk about the actions in the 3 Ps. How can you be sustainable in your personal life? What professional actions can you take to be sustainable at work? And what political, so how are you advocating for climate action? So I really like this TEDx talk, and it's online, so just look it up, by Catherine Hayhoe, who's a climate scientist. And she says the most important thing you can do to fight climate change is to talk about it. And actually you might think, oh, what's talking about it going to do? But it really is important. And actually people often don't know what they can do, or they don't want to talk about it because it's too depressing. But actually having those conversations is vital, and give people something positive they can do, as well as just sort of despairing about climate change. So I'd recommend having a watch of that. Personal actions, there's been lots of different websites, lots of different suggestions on. I like the Leeds website, which I can put a link to at the end of this presentation. And there's loads of things you can do, from buying less clothes or electricals when you don't need to making sure your bank is ethical, or your pension provider, to looking at your diet. You know, have you switched to a plant-based diet as much as you can, or can you cut down on meat or dairy anymore? How do you travel? Traveling as actively as possible, reducing car use where you can, sort of stopping flying or flying less, making sure you've made any home insulation changes that you can. And for example, not buying new cars when you don't need to. There's lots of ideas there. I don't like to preach to anyone about how they should live their life, but it's always good to find new suggestions. And professional actions. There's so much you can do as a student and as a junior doctor, from even just talking about sustainable healthcare in the different departments that you go to. There's loads of sustainable QI projects, and EcoMedics has a good repository of them, as well as Greener Practice, which is a primary care sustainability network. And if the place you're a student in, whether it's a hospital or a GP surgery, there may be a green group or people who are already looking into this. So talk to them about what they're doing and what you can get involved with. And political. It's really important as healthcare professionals that we advocate publicly about climate change, and don't just keep it in medical circles. We talk about it to our friends and family, to people we come across, about climate and health, that we tweet about it, write about it, writing to your local council, your local MP. And actually, you know, there's loads of different environmental groups or organisations. There's an Extinction Rebellion doctors group, which is open to all healthcare professionals and students. So whatever, you know, piques your interest the most, there's loads you can do to raise the profile of this really important issue. I like this quote from Socrates, be the change. The secret of change is to focus your energy not on fighting the old, but building the new. Well, I think we kind of have to do a bit of both, really. So in summary, the climate crisis is a health crisis, but actually it's a health opportunity, and there's loads of opportunities to make things better on an individual level all the way up to a global level, and it needs all of us to take action. So yeah, I'm going to stop there. Thanks so much for your time. Thanks for listening. And there's my email address. You're more than welcome to email me if you'd like to do something on sustainable healthcare, if you're looking for ideas. There's lots of things that we can suggest in hospital settings, GP settings, or anywhere else. And I've put here, I can send this presentation around maybe. It's got lots of information on organisations. MedAct is a great organisation as well, who do a lot of campaigning on climate related issues. Clean Air Hub's got lots of information about air pollution. And there's just lots of information about different things relating to sustainable healthcare in these ones. So thank you very much. And yeah, I think we've got a bit of time for questions, don't we?
Thank you very much, Dr. Agarwal, for that wonderful talk. I think I definitely agree. Climate change is becoming such an important issue these days. It not only has an impact on the world itself, but also on health outcomes, like you mentioned, with asthma and pollution and potentially other diseases. And it is a health inequality. It does affect the poor disproportionately. So yeah, it's absolutely important for the NHS, for future doctors to be aware of the dangers that this poses. And I think it's a great opportunity for you guys to enact change as well and get involved in hospitals, and even when you're talking to patients, to raise these issues to them. So we just got a few questions in the chat. I think one from Nish. Where do you think we can have the most impact in reducing the impact, I think that's in reducing the impact of the NHS on the climate?
Yeah, really good question. I would say it depends where you're working. There's no one size fits all. For example, I'm a GP trainee, and one of the big focus in GP is inhalers and medicines, because actually in GP, the carbon footprint is mostly clinical, about 60% clinical, and a huge proportion of that is inhalers. So I've decided I'm going to focus on that, because actually there's loads we can do there, and it will improve patient outcomes, it will save money, it will massively reduce the carbon footprint. And actually there's now a GP incentive scheme, so that people are talking about it more in practices, whereas I think a few years ago talked about low carbon inhalers, no one really gave monkeys. So actually now that we've got this kind of incentive scheme, what we can do is, as junior doctors, for example, or students, is to promote it, educate people in the practice or wherever about the topic, about how to do it, educating ourselves first, and then taking that to where we are. But if you're working in a different setting, then it will be different. So if you work in an anaesthetic department, finding out what they're doing on reducing desflurane use or nitrous oxide use, which are the two major hotspots in anaesthetics. If you're working in surgery, then there's lots of operating theatre is a huge carbon hotspot there. So there's a lot they can do on reducing things like waste in theatres. So yeah, there's no one answer, I think, but I think every setting there's something that can be done, and every setting has to make improvements at the moment. So there won't be anywhere where there's no work to do. It's just finding out, and actually, like, it's not always that obvious. Like, I'm working half the week at the moment in a GP surgery and half the week in a hospice, and the hospice are really interested in what they can do, and I've been sort of trying to work out where sustainability and end-of-life care come together. So that's something that I'm trying to work out at the moment. That yeah, I've just found a webinar that the UK Health Alliance and Climate Change have just done on palliative care and sustainability. So I'm going to watch that and get some ideas on what I can bring to them. So yeah, I guess as students, you move around quite a lot. The main thing is just talking to people and making them aware of the different resources and things they can do on climate change, and helping them to understand like why it's an issue as well. Because they will want to learn from you, like doctors will love to hear new ideas and stuff. And you're going to get some people who are keen, and you're going to get some people who say like, we're not here to save the planet, we're here to save patients. Someone literally said that to me like last week, and I was like, okay. So there's definitely always more sort of encouraging to be done, and I think the more people hear about it, the better. So even if you're somewhere for a short period of time, just raising the profile of the issue is a massive thing.
Yeah, absolutely. I think also the fact that you're rotating on such a regular basis also means that you can have a big impact. You can share your story to every hospital that you work in, and potentially have a big impact. I think some simple things for medical students, or even anyone really, is I've come across some really good quality improvement projects at my current hospital, in the ED, where they keep all the single-use items like the syringes, chest drains. They've started putting up a tag, just a label with the prices of each individual unit, and it really sort of raises awareness of how much it costs, not only the financial implications but also the environmental implications, and it makes you think, do I really need to use this? And that's probably one subtle way of just reducing how much you use and potentially reducing your waste as well. But other things, other simple inventions like going around, I heard somebody did a quip about going around to the theatres about 6 o'clock in the evening and seeing how many lights are still left on overnight, because there are lots of bright lights in the theatres and potentially use a lot of electricity, but they're not going to get used overnight unless it's an emergency theatre. So like having a sign that's next to the door, whoever's last to leave, it just acts as a reminder to turn the lights off, and that could, over time, because there are so many theatres across so many hospitals in the UK, there's also potential for a lot of savings there. Just another question. Have you found it difficult to promote strategies to reduce climate change or our carbon output in the workplace amongst colleagues? In the hospital, it seems that many people are very keen on climate issues.
Yeah, it's a really interesting question. Yes and no. I think a lot of people are concerned about it in general, but they don't necessarily see the link with health. And I think there can be a bit of an attitude of, well, I'm already doing my bit for the world because I'm a doctor and I'm doing good things. So that's enough good things, and I can't deal with other good things because someone else can do that. And I think it's easy to see why they think that, but actually there is a bit of encouragement that's needed in terms of why climate is related to health, why it's a health issue, why the NHS should act, all the things that kind of was talking about today, why it is a duty of a doctor or a nurse or whoever you're talking to, and actually what we can do. And actually the co-benefits, I think, are really a really good way of doing it, because if people aren't necessarily always wanting to do things on climate alone, emphasizing how this project will help patients directly, emphasizing how it will save money, all of those things actually could encourage people to want to do things even if they're not understanding the climate issue in itself. For example, someone's done a really great project on computers at Imperial. There's 5 hospitals there. They've saved, I can't remember exactly how much it was. I think it was 140 grand in a year. Maybe it was more. No, they spent 140 grand on the project and they saved 500,000 in a year. That was it. From getting all the installing software that turned all the computers off when they weren't being used, all the ones that weren't like in sort of acute settings and stuff. So it was really interesting, and I've sort of been talking to them about how we can roll it out to other hospitals. But the hospital, you know, we've got an energy crisis now, and they probably really want to save all that money. So come at it at whichever angle you think the person might you know be interested in. That might not be climate as number one, but you could sell it as, oh, this will save money and it will also reduce our climate carbon footprint. Have I found it difficult? Yes and no. Someone literally said to me, as I said last week, we're not here to save the planet. I have yet to do a presentation in that setting about climate change, but hopefully they'll start to sort of change their mind. Yeah, I think it does vary, but I think people are generally concerned about it. So when the health message is brought in, that, you know, some people will come around, some people won't, but yeah, I think don't let it put you off, because there are loads of people who actually will love to hear it. I would say the vast majority, when you talk about it, will be like, oh, that's so interesting, tell me more. So no, I've not found most people kind of resistant to the topic of conversation.
Wonderful. And I think if we don't have any other questions, I think I will wrap things up here. Thank you very much again, Dr. Garwell, for that wonderful talk. We'll be sending out some feedback forms to all of you afterwards, just to get an idea of what we've done well, what things we can improve on for future sessions. And thank you very much for coming this evening.
Thanks everyone for coming. Thanks Luke for inviting me.
Thank you.